Dr. Brian Sandroff directs the Exercise Neurorehabilitation Research Laboratory at Kessler Foundation's Center for Neuropsychology and Neuroscience Research, where he also serves as assistant director. The lab focuses on creating and evaluating exercise training programs to enhance the physical, cognitive, and brain health of people with multiple sclerosis. And it's always my pleasure to meet up with Dr. Sandroff at CMSC. It's good to see you.
Great to see you too, John. Thanks for talking.
Historically, cognitive rehabilitation focused on compensatory strategies, like using planners and memory aids. Your work is helping prove that exercise can actually target the underlying neural pathways. The presentation today directly asks, can exercise be used to treat cognitive impairment? For a long time, exercise was viewed as a way to improve general health or mobility in MS. How does framing exercise as a direct treatment for cognitive impairment change how a neurologist might prescribe it in the clinic?
So that is a wonderful question, because that's the question that really drives our research. If exercise can demonstrably change the brain, we know that cognition comes largely from the brain. And if we can develop our programs in such a way that target the brain, that can make changes in networks in the brain that are so important for cognitive performance and thinking performance, we've essentially created a target for improving cognition and in everyday life outcomes in people with MS. So if we can provide biological evidence to support exercise benefits of the brain and central nervous system, and then we can develop evidence that shows that that extends into cognitive tests, and we have evidence where it helps people with MS in life, then hopefully that evidence can get integrated in clinics, but neurologists and memory care therapists can recommend exercise as an approach to help cognition in people with disease.
When we look at standard disease-modifying therapies, they're highly effective at reducing relapses, but have a limited direct impact on repairing pre-existing cognitive damage. Do you see exercise as a necessary synergistic therapy alongside DMTs to protect and restore that cognitive reserve?
That is a trial I would absolutely love to do, and one that's on our radar. We've argued in the past that exercise could have potential disease-modifying properties associated with its biological benefits, but we've never actually directly tested it either against disease-modifying therapies or, more importantly, in principle disease-modifying therapies. As you're right, the DMTs are not designed to improve cognition, but they've been wonderfully effective in improving many other aspects. So it is something that we wonder often and something we would love to test.
Keep our eye on that thing, for sure. In your targeted randomized controlled trials, you looked specifically at supervised treadmill walking and its impact on verbal learning and memory. Why does aerobic walking specifically seem to have such a profound impact on learning and memory compared to low-intensity resistance or stretching?
So our research not only is focused on learning and memory, but also on cognitive processing speed as the primary cognitive in MS. And what we think is going on is that exercise involves all these different demands that cause the brain to work really hard to be able to continue to exercise. And by continuing to exercise those brain areas, the brain becomes more efficient, and that increased efficiency results in downstream improvements in cognition and other outcomes, including learning and memory, or cognitive processing speed that rely upon those the brain outcomes, where that increased efficiency not just supports exercise, it also supports cognition and thinking.
Your pilot neuroimaging data showed that 12 weeks of treadmill training actually helped preserve hippocampal volume in patients with relapsing organic MS. Can you explain the mechanisms at play there? Is it driven by increased blood flow, neuroplasticity, or perhaps neuroprotective factors like leading?
So our research suggests that it has to do with increased connectivity in the brain as a primary way to potentially preserve hippocampal volume. And one of the interesting findings of that particular study is that the results are consistent with those from animal research done in 1992, for example, where environmental enrichment in mice was associated with increased neurogenesis in the hippocampus. And exercise is certainly an enriched environment where when people are walking on a treadmill, that's not something you do on your everyday, life and your everyday existence, where that's really making your brain work hard. And the hippocampus is a region that really responds to increased environmental enrichment. So one of our core hypotheses was that by continuing to exercise 3 days a week for 3 months, we really had that stimulation. We're not quite sure if it's a blood flow, or we're not quite sure if it's molecular cellular mechanisms like BDNF or IGF-1, for example. But I think that those are more supportive mechanisms, with the primary mechanism being all that work that your brain has to do to continue to exercise, and then that causes adaptations.
Thalamic and hippocampal atrophy can occur very early in these process, right? Does your research suggest that exercise is most effective as a preventative strategy early in the diagnosis, or can it still restore volume and functional activity of patients with long-standing depression?
So that's been one of the million-dollar questions in our lab as well. Our research largely supports these effects in people who have had some symptoms and have had some advancement of the disease, but not quite to the point of advanced progressive MS. But we do have other evidence, specifically from the COGEX trial, that exercise plus cognitive rehabilitation did induce some brain changes in some MS over a 12-week period. So again, there's signal there. We just have to really do a good job of isolating to figure out what exact prescription might be best for individuals who present differently.
Well, speaking of prescriptions, clinicians often struggle with describing a specific dose of exercise for cognition.
Mm-hmm.
Based on your current data, is there an ideal frequency, intensity, duration that's required before a patient starts showing measurable improvement?
So our data right now are not quite in the advanced stages of having a definitive 100% proven prescription. But the data from our lab that has resulted in cognitive and brain improvements actually involve walking a moderate to vigorous intensity, starting very small, like 10 minutes per session, a couple days a week, moving up to 3 days a week, and on the way up to about 30 minutes of moderate to vigorous exercise. Now, the nice thing about that is that aligns really well with the Canadian Physical Activity Guidelines for adults with MS, where our walking intervention really mirrors the aerobic prescription that is appropriate for people with MS. So those guidelines are publicly available, and they give tips and tricks for how to do the exercise, where to do the exercise, and what to do for general health benefits. But maybe that could extend the cognition and brain health too.
And CMSC, you're speaking to an audience of volunteers, nurses, physical therapists, and psychologists. So if a clinic wants to implement your findings next Monday, what's the biggest barrier they need to overcome? Is it patient adherence, or is it the lack of standardized cognitive screening, something like SBMT, to track progress, or is it something else?
I think the biggest barrier would be personnel and time, because our interventions involve a lot of behavioral support for participants, where our participants interact with behavior coaches who help teach participants with MS the skills and knowledge to change to maintain their exercise behaviors benefits. Now, if a clinician wants to deliver that one day, I'm not sure how they would allocate time and personnel needed to be able to deliver that behavioral support, especially considering that our behaviorists in our trials were really thoroughly trained to think quickly on their feet, use supportive accountability mechanisms to help when barriers arise, and help each individual participant in this iteration. Now, I don't know if those personnel are regulated in the clinic, I'm guessing not, but the next phase of research for us, one of the next phases involves looking at the potential implementation of programs in clinic, because at the end of the day, that's where the magic happens. And that is something that we very much need to do for our program.
People living with MS or experiencing cognitive fatigue often find it incredibly difficult to motivate themselves to begin an exercise regimen. What strategies or behavioral approaches have you found to be effective in helping patients overcome that initial barrier so they can stick with the program long enough to see those benefits?
I think the initial part is the hardest, for sure, especially when you're feeling it. One of the things that you keep in the back of your mind, though, is that all the outcomes studied in response to exercise in terms of the benefits, the single most well-established one that exercise reduces fatigue in people with MS. And it's to the effect of about half a standard deviation in magnitude, which has been shown in the literature to be universally remarkable. Half standard deviation is a big deal. So that is one thing you can keep in the back of your mind. Front of your mind, this starts small. It's every little bit. It's like saving a little bit of money in the bank over time. It grows, and you have to listen to your body. Some off days, you don't need to go to the gym and exercise vigorously right now. Starting small, sitting less, moving more, and slowly accumulating more and more in exercise over the long run. It's a marathon, not a sprint, party time.
Well, Dr. Brian Sandroff, thank you for all you do to improve the lives of people who are living with MS. Thanks so much for talking with me today.
Of course, and thank you for all you do.